I'm Al McFarlane. Good afternoon. Welcome to Conversations with Al McFarlane. We continue our series, daily town hall meetings discussing our community's response to the COVID-19 pandemic. Thanks to the Minnesota Department of Health for funding this series of conversations. The strategy is that we'll reach out through this platform to agencies, to organizations, to individuals, to leaders of public and private institutions, government, businesses that in one way or another are connected to the fight to keep our communities safe, knowledgeable, informed, able to make good decisions about how we address COVID-19 specifically. Of course, that means how we approach health and well-being in general in our community. It's about the pandemic at hand, but I find our discussions also lead to an examination of not only the COVID-19 pandemic, but what my colleagues are calling the pandemic of 1619, the question of race and culture and the impact of white supremacy on the lives of Black and brown bodies in our country. So there we go. I want to introduce my colleague and co-host for the program. Brenda Gray is a writer, educator, columnist for Insight News, and a former teacher, and joins me in this venture of documenting these conversations. Brenda and I'm always proud to say, go back to being classmates in kindergarten in Kansas City, Missouri. So when we were 5, we met, and though we've been apart for many, many years, we've been friends from day one. So it's a pleasure to have the opportunity to work with Brenda Lyle Gray right now. Today's program features 2 wonderful organizations and 3 old and new friends, old friends, Shane Price and Dr. Verna Cornelia, who are working in community doing, Verna Cornelia Price. Is that the right way? Okay. And you can correct me, unmute your mics, guys, correct me as I go along, but we'll talk about what your organization is doing. And also a new friend is Megan Mueller. She's the Associate Director of Education and Prevention at JustUS Health. Megan, I'll start with you. Megan oversees the professional education program, the HIV testing and outreach, the mainline syringe exchange, as well as the Shift Men Tobacco-Free Communities team. She's passionate about teaching professionals with hopes that that the education they get will trickle down into more competent care for the community that we love and serve. She thrives doing prevention work and empowering communities with test education and supplies that allow people to make their own decisions through a risk reduction, sex positive lens. She's got a master's degree in public health from BRAC University in Bangladesh, where she lived, studied, and worked with an infectious disease research hospital in the capital, Dhaka. She previously worked for University of Wisconsin-Madison for the School of Medicine and Public Health, doing tobacco cessation work. And she lived in Minneapolis with her partner, Theo, their son, Harrison. And she says 3 furry non-human children, Nico, Reginald, and Lucille. Megan, welcome. That's a nice resume. Welcome to the program today.
Thank you so much for having us.
Well, let me start by 2 things. Talk specifically about what JustUS Health is doing around COVID-19, but then use that as simply a point of departure, what you do generally, what the mission, the vision, the work is, and how these things all tie together.
Absolutely. So JustUS Health is, it sounds like a newer organization, but we've actually been around for quite a while. So our predecessor organizations are the Minnesota AIDS Project and Rainbow Health Initiative. So we've been around since 1983, since the beginning of the AIDS epidemic. We're really grateful. We have 2 different contracts right now with the Minnesota Department of Health to do COVID specific work. One of those contracts has been about communications. I think one thing that we've been doing that's been really amazing is just using our platform to relay information about testing sites and answering questions that come from the community, because the Minnesota Department of Health and their partners in Hennepin County, Ramsey County, they're making all of these testing sites, but getting those sites available and having people have trust in those sites and having their questions answered is a whole other piece of that. And so we're really filling that void. Another piece of that work is really taking the information and putting it and bringing it down to people in a way that's a little bit more digestible. So I don't know about anyone else listening to this, but those data facts and lists and sheets of all of the to-dos and how-to-dos and what we need to know, they go a little bit right over my head nowadays because there's just information overload. There's a lot going on. And so we're trying to take that and simplify it into a message that might be a little bit easier for people to hear and see. Part of what we're doing there is taking a lot of local artists and local art and having them kind of revision and recreate a lot of this like data and messaging and put it out in a way that might be like a video that's more of like a PSA that's funny and cheeky, but it's also informational. Where we have some posters that are really, you know, made by the people for the people. And I think that they're a lot easier to look at than a fact sheet with bullet points. So really taking that high level scientific information and putting it through a local artist lens and then pushing it back out in a way that could get the information to people a little bit better. So that's one piece of our work, is really that art and communications heavy, trying to get people access to information and testing sites. And then the other work that we're doing that's really COVID specific is we've opened up a hotline. So we're one of 40 organizations that are funded to open up a hotline that helps people navigate the different existing resources. So we do provide, you know, minimal direct services, like we can send people protective equipment such as masks, hand sanitizer, cleaning equipment, but we're more so navigating the existing resources. There's a lot of organizations funded to do some really incredible work, like get food to people, help people pay for utilities, rent, mortgages, but those programs live all over in these different areas. And so we have an amazing team on board that has compiled lists and has reached out and made connections with all of these places. And those folks are there to help people navigate everything that's available. So anyone can call that hotline and get information about how to access any of those available resources. So our COVID hotline would be the other really big piece of that. We're only one organization. There's 40 organizations that are also doing this. So there's a lot of different orgs that are community specific. So we are the LGBTQ community org funded to open a hotline, but anyone can call, literally anybody. We don't turn anyone away, but if somebody would feel more comfortable with an organization that better fits their needs, there's a lot of orgs that are for African-born folks or African-American folks or Latinx populations. So there's a lot of different community orgs that are funded to do similar work. So you could call us or you could call one of them and you'll get a very similar service. So I think those are the really specific COVID work that we're doing, but we also have been impacted by COVID on every layer of our organization. So we have over 25 programs and services. I will not list all of them and bore you all with that, but a lot of them are specific to serving people living with HIV, like case management, housing, transportation. We operate the AIDS line, the statewide information hotline about HIV, and every aspect of our organization has been impacted by COVID. You know, we're seeing folks that have been out of care with HIV for a long time that are now saying, I want to get back in care. I need access to medication. I need a doctor. I need to get back connected to folks because now I'm really worried because COVID is around and I want to make sure that my HIV care is under control. So we're seeing a lot more people getting back into care. We're seeing people wanting to engage with healthcare in different ways, maybe even needing access to computers to allow folks to be able to do telehealth and video care. We have a behavioral health clinic, so we've been helping a lot of people with, you know, the stress, the anxiety that this pandemic has caused, which can really be impactful on a layer of already existing healthcare concerns. So we have some really COVID specific work, but I would say our whole organization has been touched by this pandemic.
one thing we might do in the course of the conversation, you should pull up your webpage for your organization, and we can share screen later on. And you might want to put the contact page, for example, or we can flip through that and maybe the opening page that talks about the mission of the organization and its background. But the main thing is to let people know how to get to the information that you're providing through your web page and other resources. Thank you for that introduction. We'll come back, and you raised a number of questions that I'm going to be happy to ask you about, because I know you're going to be able to shed light on different connections and challenges and responses to the challenges. And that's what this program is all about. I want to bring in now my friends, Dr. Verna Cornelia Price and Brother Shane Price. And their organization is called the Power of People Leadership Institute. They co-founded it in 2007. And the initiative addresses the trends of increased violence and decreased academic engagement in girls grades 6 through 12. And they address it through mentoring and positive leaders and role models. And they've been doing wonderful work. The mission, they say, is to engage youth and adults in research-based interactive learning experiences through mentoring and curriculum that challenges, inspires, and informs them to overcome their obstacles and find success in every area of life through personal power, personal development, and leadership training. And their three core programs are Girls Taking Action, Replanting Program, and Boys of Hope Program. Shane and Verna, good to see you. Thank you, and welcome to Conversations with Al McFarlane. You have to unmute your mics.
Yes, great to see you. And it's been a long time, you know, that since we've sat down and had a chat together, but I follow you, and I'm just proud of your consistency. As Elder Mahmoud would say, consistency is the only thing that grants authority. And so thank you for that, and give well wishes to your wife, Bobby, from us, and Batala as well, and all of the gang over at Inside News, who are all friends to us.
Absolutely. Well, thank you so much.
And I'll just start quickly talking about the replanting part of the three components, program components that Mr. McFarlane just mentioned. Replanting is specific to incarceration, training offenders inside of the correctional facilities. We've been at that for about 15 years, and then building a wraparound continuum of support for those individuals upon release, which would include housing and of course employment, but post-secondary education, and then also health. Now we've had to add the component of personal health and community health, as COVID-19 has stamped us nationally and internationally with a mandate to be vigilant. In that vigilance, we have contracted with the Department of Health, and our specific role has been to work on that reentry community being tested. And you know, I mean, I don't know if you guys are aware, and perhaps you are, but for instance, in the Stillwater facility now, just right now, there are over 700 positive cases right now in Stillwater. And that makes up more than 2/3 of their entire population. So when those individuals are reentering,
344-6363. Call now. 1-800-344-6363.
It's like a super spreader event or environment that's a super spreader.
Absolutely. And so we have to be really vigilant where that's concerned. We have about a 65 member core group that we work with on a day in, day out, week in, week out, month in, month out basis, 65 individuals. We probably have had those 65 individuals since March tested at least 6 times. And our belief is that if you can reach a negative bottom line and then allow the PPE to really work, to be vigilant about that, that you have a good opportunity to stay negative and to keep your family safe. We have had 3 or 4 infections over that period, but on today, of the 65 member core group we have 0 infections on today. And we feel real good about that. And to accomplish that goal, and then I'll pass to my wife here, is that my wife, who is one of the 100 people to know in the state of Minnesota. So we're in good company here. Well, we organized our own event. Megan, we utilize some of the community events as well, testing sites, and we've partnered with Babington and New Salem, and we've partnered with many of the other churches, but we've also organized our own site, and we went after the reentry population, not just our guys, but those around the Twin Cities. Something really interesting happened, Mr. McFarlane. Many of the sites who house guys in reentry, they weren't interested in our offer to partner. They weren't interested in our desire to test and reach this negative bottom line unilaterally, and we were disappointed by that. We couldn't understand that logic, but later on, unfortunately for some of those organizations, they've had to shut down and quarantine and take their guys out of their employment status because the infection has in fact invaded their housing premise. So we feel good in some ways that we have been proactive. Our relationship with the Minnesota Department of Health has lifted our conscious level about the dynamic of health and what the dynamics of COVID can really mean to us. Over 3,000 deaths yesterday in the nation. It's an astronomical number. We're not out of the woods yet, and we're continuing to fight on the ground level. I'm going to pass to my wife here.
Thank you for that introduction, Shane. It's so important. Thank you. Dr. Verna.
Oh, absolutely. Absolutely. Well, it's great to see you again. Just for the audience, just history, many years ago, when I first published my very first book, and there were many people who said, oh, that little purple book is just too simple. It needs to be just a little bit more, so forth and so on. And so it was Al McFarlane that actually invited me to remember Lucille's Kitchen? We used to be on Lucille's Kitchen, and it was Al McFarlane who invited me to come as an author to share my book with the community. And Mr. McFarlane, you, one of these days, will have to have tea, and I will tell you the true impact of what that launch into my community did for my life, my marriage, my family, and my career. So I just want to, first of all, just say thank you for being an adder and a multiplier for so many of us in this town. The Power People Leadership Institute, we're a very organic organization. And for many people, they've just not ever even heard of us, although they know our work. They just don't quite know like the organization behind it, because my husband and I literally we've like what the old people would say, we've put our heads down and we've just gotten the work done.
Right.
And so we have been, across prisons in the state of Minnesota, impacting over 6,000 offenders in this town. We have been in almost every school district, classroom systems. impacting over 5,000 girls in this town, just bringing the key message that you really can change your life. And you have the power to do so. And that's been a really critical message, I think, for us in this whole COVID piece, because the reality is in the African-American community and many other communities, Megan, as you're saying, is that people are very skeptical of this COVID thing. They are very skeptical. And it didn't just start, of course. Communities of color have historically been skeptical of the medical industry.
And rightfully
period.
so.
And rightfully so, right? And so with all of this coming up, and now, of course, MDH, which we've actually enjoyed working with MDH. They've done a good job. And when I say good job, I mean that they have been intentional about reaching into our communities and finding the organizations who are doing authentic work, on the ground, frontline work to get this message out. But as we reach into our community to give them this message that your health and well-being
Matters.
not only does it matter to you, and that you have personal power. You have to use, if there's any time to use your personal power, today is the day. Like, go get in the line, go spit in that valve and get tested. Go get your throat or nose, whatever's, processed to get tested. And that's a way for you now to actually protect yourself and your family. And so for us being able to, I think because we've been teaching our community that you have the power, you have what it takes to create change in your lives. I think that message was an amazing foundation for our community to be able to say, yes, you can do this thing. We can get through this thing, but it's not been an easy road. It's just not been easy at all. So, and now, of course, we have a new boys initiative, Boys of Hope, which, let me just say to the audience who's listening too, if you have girls and you have boys, grades 6 through 12, who are at home, they're not engaged, they don't have anything to do, you've got to get them enrolled in our Girls Taking Action program or Boys of Hope. All of our programs are virtual. Our mentors are ready and willing to work with our young people, but we got to get them on the screen. And so to mamas and daddies, you know what, the aunties and grandmas, instead of just having them on their computers, just like moving around and Snapchatting and Instagramming and, Facebooking and doing absolutely nothing, get them on a screen with our mentors who can actually help them rethink who they are, how they are, and give them information about COVID. So that because the rise, the spike now in young people is pretty alarming, and young people aren't taking it seriously. So we have to get them on the screen so we can help them and mentor them in that way. I'll stop there.
So that's great. So how do we do that, both of you, for boys and girls? How do we capture? I mean, first of all, even go more into why it's so important. I think what you're doing is absolutely critical. So the question is, how do we explain the critical nature of this work so that the public is supportive, that there is a public mind that understands, that grasps the severity and the massiveness of the challenge, but also that has in it a sense of the power of individuals and families and communities to rise to and transcend the challenge and move us transformationally towards being our best selves as individuals and as community. How do we get that kind of conversation going so that instead of just chit-chatting lightly, we talk substantially substantively about who we are, what we are, and what our purpose and mission are? What do you think, guys?
That's an excellent question. I'm just going to, Megan, if you don't mind, I'm just going to jump in quick and then we'll pass. Have you noticed how much information you are currently getting about vaccine? The message about vaccine is literally.
Okay, we got a screen freeze here real quick. Megan, is your screen live still?
Yep, it is.
Shane, you're kind of frozen up right now, but Megan, go ahead and jump in, and then Shane and Renita will come back in.
Sure. I'll be happy to defer back to Shane when their internet and their video comes back. Oh, I think it's back now.
Okay, you were frozen for a second there, Shane, but go ahead.
Okay. Was moving, it allows, it forces us to pay attention to the nuances of the message, whether or not you're interested or want to be or want to hear it. I think that we have to get that same type of intentionality about messaging in our community. And as Megan indicated earlier, Mr. McFarlane, that message needs to be different, not just data-driven, although data may be the operational foundation, but situational driven, creative, flashy, important and in your face. What we have found with our guys is our consistency with them, continuing to talk about testing, continuing to make it available, picking them up in vans and taking them ourselves. Mm-hmm. Well, what that did was cause their own consciousness to rise about it, and then they move that information to their families. Well, that's a generational pass. And so to Mr. McFarlane's question, what we've got to do in some ways is create a message so strong that it's passed through generations. When we can get that done, and it's been done before. Our area is small enough, the Twin Cities is small enough that we could saturate that area with maybe Mr. McFarlane convening all of the news media, everyone who has printed, digital, or electronic media, convening a meeting and then agreeing in that meeting that everyone is going to put this message forward. PBS and KTCA, everybody is going to push this message as a part of our unified media effort to heighten the conscious level of the Twin Cities and surrounding areas around the danger in COVID. And Mr. McFarlane, I believe that you would be our guy for convening just such a meeting. I'm going to pass to Megan or to my wife.
Go ahead, Megan.
Yeah, I think those are just amazing points. And just to build on that, I think that as minority populations, be that racial minority populations or sexual or gender minority populations, every day we're interacting with systems that were not built with us in mind. Systems, healthcare systems, education systems, prison systems, they're all built for the majority. They're built for white, straight, cisgender people. And so when you look at interacting with those systems, if you are a minority population from any community, from any avenue, you experience little injustices. You experience things that usually people don't notice. You notice the heteronormativity in the questions. You notice the forms that don't even have an option that fits you. You notice doctors that were trained in systems that didn't even have any information about how to care for you and your healthcare needs. You have insurance claims that get rejected. You have really unethical research practices that have historically been done and still continue to be done. And so I like to refer to it as just this earned, a lot of people say distrust in the medical system. I like to call it an earned distrust in the medical system, because there are a lot of points that you can trace back to why people feel this way, why as we get information about vaccines and people are hesitant, yes, of course they are. Have we learned anything from our past about healing, about rebuilding, about ownership for these mistakes? I mean, I don't think there has been a lot of reparations or ownership for some of these incredibly horrendous things that have been done to, Black folks, brown folks, LGBTQ folks. There's a lot of really clear examples of unethical research and unethical healthcare practices. So I think as we lean into things like the vaccine and trying to get that information out there, I want to see people like me in my community. I want to see people at the forefront saying, that they've been involved, that these systems have been tested on us, that these vaccines have been tested on us, so that as we go down the road of trying to, get our communities connected to things like vaccines, we know that we're giving something that's been thoroughly tested on our people, that vaccine. We don't want to lead people to something that's not going to be correct, which I don't believe is true with the vaccine. Let me just be clear on that. From what I've heard, it's been really thoroughly researched. A lot of people are worried about how quickly it's happened. And I was in a meeting earlier this week where I learned a lot about how rigorous it has been and how they haven't cut any corners and how it's been really, really thoroughly tested. And people are concerned about how quickly that has happened, but it's just been an incredible amount of resources that has enabled this process to go so quickly. So I want to see, people, leaders in our communities really stepping up to display that information, because I don't think that just hearing it from maybe like the Minnesota Department of Health or some other authorities, even, political authorities, I'm not sure that that's helping a lot right now. I think we need to see people embedded in these communities that people trust relaying this information out there, because I think it's going to be really difficult to combat that skepticism and that earned distrust.
Let me tell you a story that I think all of us can relate to, and it particularly involves the HIV work that was early on, and the tension between the origin of solutions from within our community and the resistance to the demand for engagement and particularly for access to resources.
Wow.
The long and short of the story I'm about to tell is that we have to know and believe and act out of a conviction that we have both a duty and a right to lay our hands on the public assets, resources, public treasury, to fund solutions we bring to our community and to community at large, that we cannot be relegated to the problem side of the equation, that we have to be seen as and operate as the creators, the sources of the solution. And that attitude puts the problem in proper context, not as intractable and not as unavoidable and not as the definition of who we are.
Right.
The definition of who we are lies in our capacity to solve problems. We must be seen and see ourselves as problem solvers. So some years ago, and this speaks to what you were saying, Brother Shane, I reached out to, I used to go at Insight and knock on different corporate and state doors and ask companies and agencies to buy advertising Insight News. And as often as not, particularly in the corporate area, I get the story where, "Oh, Al, I like you, you're a nice guy. Nice little project you got there, Insight News, North Minneapolis, very nice. But I gave in church on Sunday, get out of here."
Right.
Kick you out, because the perception of my livelihood to them was a hobby.
Right.
For me, it's livelihood, communities, jobs, mortgage, employees, right?
Absolutely.
My life did not matter.
Mhm.
They perceived me and mine as part of something that is an afterthought at best. Always the mission, keep me at the margin. I went out to the other colleagues, Shane, you remember this, with the Asian, Latino, Native American, African media, and discovered we all had exactly the same problem.
Right.
And proposed that we unify, collaborate, and we created the Minnesota Minority Media Coalition, which is now the Minnesota Multicultural Media Consortium.
Right.
But that allowed us to go to the market saying that I'm here not representing just Al McFarlane, but representing, and you thought the offer I came with was too small. But now I'm here on behalf of 300,000 Black, Asian, Latino, Native people. Is that a number you can deal with? Capital idea, great idea. We were very successful with it. But
Right.
early on, our first contact was with the health department.
Right.
And we approached them because at that time, the HIV pandemic was surfacing in the country, and around it was massive disinformation assassinating the character of African people, Black people, condemning and painting us in the eyes of the world, in our own eyes, as deficient and therefore the cause for HIV. It was the Black people and green monkeys, right?
Right.
Despite the fact that patient zero came out of London. right?
Right.
So disinformation that attempted to derail and delegitimize our humanity. And we went to the health department saying, you guys got to tell the truth, number one, and use our media to tell the truth to our people, and you got to pay for it.
Right.
We're in business to do that. And the response at the health department at that time was, well, anybody Black that can read is probably reading the Star Tribune, and we don't need to use a Black newspaper to reach Black people. And you just diddle that out to other communities of color. So
Right.
what is the lesson? The lesson is this arrogance that typifies and reflects white supremacist thought. The idea that we must genuflect at the altar of white supremacy, and that our lives, our thoughts, our interests as we articulate them do not matter.
Right.
And so we continue to fight that battle. And what you are doing, I think, is building on this idea that we simply know that our solutions are going to come from us.
Right.
And that we are the authors, that we are co-equal creators of the future through our thoughts, our history, and our intellect, right? The genius that we bring to today. So that's kind of the Al McFarlane soliloquy, how I look at things and how I so value what you do and the energy you bring, Dr. Verna, in helping us be clear on who we are and what our responsibilities are. So take off from there for a second, Dr. Verna, and talk about this idea of what it means to be an adder and a multiplier in our community and culture, and how that is impacted by and how it impacts the pandemic of 1619.
Absolutely, absolutely, absolutely. Just the other day, we were on a call with MDH, and so this whole conversation of vaccines came up and everything. And my husband made it was such a clear point, and I thought that's exactly it. He said, you know, this as we take a look at this work, the truth is that we haven't even gotten a message of testing out to our community. The truth is that there's in our community, people are still afraid to even be tested, even get in the line to even be tested, much less think about, now we want to get a vaccine to you. So that building of trust with our community is really, really a critical piece. And to let our community know that, you know, as organizations and as individuals, we're here to help. And we are not spies for the white people. You see what I'm saying? We're not like undercover. We're just here because somebody gave us a little bit of money so that we can, you know, continue in the destruction of the community. That is not who we are. Right. And the truth of the matter is that we were being adders, which means that you are without any strings attached. You are committed and passionate about your community, about your people, and that you are giving and that you are adding to, and that you are raising and increasing the value of your community every day. And, you know, and as we look at that work, you know, that's what we do every day. I mean, literally every day. From you don't have a bed, we buy you a bed. You mean, and I mean, these are, and of course, you know, these are things that we don't go around saying, well, you know, oh, we're adders, and, you know, Megan, you don't go around saying every day, well, you know what, you know those calls that you get in the middle of the night, you know those calls, where it's like, who do you call, right? Who do you even tell that to? And as powerful people in our community, you know, we stand in that place of both personal power as adders. But now we're stepping up now as positional adders in our communities, where we can be holders of this information, holders of these resources, and be trusted to know we're taking this straight to our community. And we're not doing it just because of this. We're doing it because it's the right thing to do. We're doing it, Mr. McFarlane, because it's what we've always been doing. And if something is coming at our community, then we have to stand in that gap, and we have been standing there for a really long time, you know. And go ahead.
Well, I think she's right on it. I want to maybe try to tie this into a move by 17 states in the United States to overthrow the outcome of the election.
Mm-hmm.
And I think it's germane to what we're talking about right now.
Mhm.
In that, the notion here is, listen, our former president has exposed our true feelings about people of color and about who we are as white folks. We're angry about it. We're still angry about the projections of the population and the nature of the impact on us. We feel threatened to lose our power. Now watch this. And in some ways, the virus, you'll remember the state of South Dakota and North Dakota elected not to mask, not to shut down, not to take the virus seriously. Our governor, to his credit, worked very hard to try to support the people of Minnesota. But because our borders interface with one another, it was clear that the transmission between South Dakota and North Dakota was impacting in that Fargo-Moorhead area, and now their numbers are astronomical. And in some ways, the arrogance, Mr. McFarlane, of white supremacy won't even allow itself to appreciate what's necessary to keep a nation safe and vis-a-vis their people. And so, you understand then the work is really difficult, but yet we've faced difficult challenges before.
Yeah.
And in the midst of even that, we are resilient and able to do business in the face of adversity and do it correctly and with integrity. And that in some ways is what my wife and I are continuing to do. People trust us. And we want to make sure that the information that we're sharing and that whenever a vaccine comes down the line, which will be months from now, that is safe and secure. We'll be on another meeting tomorrow where we're asking serious questions about the analysis of safety, the testing on people of color, as Megan has indicated, so that we can communicate a correct message. And further, we ought to be a part of our own solution, and vis-a-vis MDH and others need to be a part of that. I won't, however, back off the notion that that messaging is important, and that the organization that you created, Mr. McFarlane, I remember when you began that work, is so powerful. But now it's time to utilize that unity to pull down on the larger resource base, because we have to get the message across. Our people have been at least more diligent than some of our white brothers and sisters who are intelligent, have had the benefit of education, but white supremacy won't allow them to operate as an educated people. I'll stop there.
That's a big statement. Listen, we're almost out of time, but this has been a wonderful conversation, and this is the conversation that I intended to have, so we can speak freely and from the heart, and illuminate, provide background, context, not only about the specific challenges of COVID-19, but the cultural environment, historical environment in which we operate, and the need for our people to keep both being present and keep moving forward. Megan, give people information on how to connect with you and contact you for support and your services. And then Shane, you and Dr. Werner might do the same.
Absolutely, yeah. I just want to say, before diving into JustUS Health, I can see why people trust you, Dr. Werner and Brother Shane, and I can see why it's really important to have voices like yours out there. I'm going to share my screen here for a second and give you information about our COVID hotline, so you can see that. So this is our landing page for our COVID community coordinators. That's what we're called. You can call this number, the 612-254-0116, with any questions that anyone has about COVID. We can help people find the right referral. We can help people fill out forms and access different programs. Again, as JustUS Health, we're just really interested in that intersection of how people's identity impacts their ability to access healthcare. So we're really open for anyone to call this line. So this would be the best way to reach us for COVID related questions.
Awesome. And Dr. Verna and Shane, contact information for you.
Sure. I am going to come back to here, and I'm going to share my screen as well.
Mhm.
Let me just see here.
Well, Megan, good to meet you in
Yes.
some ways, and thank you for the work that you're doing. First of all, we'll just give you our contact phone number as my wife is seeking to pull up our page. You can reach us at the Power of People Leadership Institute office at 763-535-5711.
5711.
That's 763-535-5711.
And our email, our website is popinstitute.org, popinstitute.org. And you'll, you get to take a look at all the different programs that we're doing and how to get involved with those. I'll go back to our youth programs. If you want your young people involved, here are the links right here to enroll them and to give your consent as parents. So we'd love to have you. We'd love to have you a part of that work.
Great. Well, listen, thank you all very much. Thank you, Megan Mueller. Thank you, Dr. Verna Cornelia Price and Brother Shane Price. All of you are my favorite people. I really respect and love you for the work that you do, for the people that you are. And for those who are listening on YouTube or Facebook, we're doing this conversation 7 days a week, every day at noon between now and the end of the year. We hope that this proves of value to not only our colleagues and stakeholders and community, but to you, the listeners and viewers, and to our community. And perhaps we should be able to continue this kind of conversation into 2021, because we know that the impact of Thanksgiving, the impact of Christmas, the impact of winter, and the race against the mounting infections and deaths, while we move towards the potential solution of vaccine and therapies, is going to be a critical time for all of us. So we need to keep the conversation going.
Yes.
I'm Al McFarlane, and we'll see you tomorrow at noon. Take care. Thank you all.
Thank
Bye-bye.
you.
Let me see that one.
Al,
Yes.
they both.
Hold on.
familiar-
Wait.
Oh, I'm sorry. Oh, I thought we were off. I'm sorry.
No, we're still live. Hang on. Call me.
Okay, I will.